Hi, this is Dr. Mura just again from Dr. Mura Health. This follows up with the previous video where we introduced diabetes mellitus. Today we're going to continue a little bit to bring more awareness and the seriousness of this condition. Again, so when you talk about diabetes, we talk about specifically diabetes mellitus. And this is because there is another condition called diabetes insipidus, which has totally nothing to do with diabetes mellitus. Diabetes insipidus is basically where there is, decreased production or there is no production of antidiuretic hormone in the brain, or there is a decreased effects of antidiuretic hormone in the kidneys, and basically where the patient become polyuric, and that we deal with that condition more in the ICU, but it has totally nothing to do with diabetic mellitus. So every time I say diabetes, I'm referring to diabetes mellitus, not diabetic insipidus. Anyway, so what is diabetes mellitus? So as you can hear, it has just two words, diabetes and mellitus. Diabetes, it is a Greek word which just means passing through or siphon. And mellitus is a Latin word meaning sweet or honey. So if you are diabetic, you are sweet or you're honey. Not quite. In fact, out of interest, do you know how the doctors used to diagnose diabetes before? What they used to do, they used to basically to test the urine of a diabetic patient. So apparently the urine of a diabetic patient is sweet, and that's basically how they used to come to diagnosis of diabetes mellitus. Thank God today we don't have to test urine to be able to diagnose. We have so many other ways we can test this condition. So diabetes mellitus is characterized of chronically elevated levels of sugar in your blood. This is mainly because there is a decreased production of insulin, a small organ in your abdomen called the pancreas, which produces this insulin. So there could be a decrease, or there's no production, or there could be resistance to the insulin that is produced already. And so we're going to be talking about 7 different types of diabetes mellitus. You may be saying 7, that's way too much. You probably have heard of 2 or 3 if you are well educated. And the reasoning is we need to be able to differentiate them, and so that we can adequately, approach them adequately. Because if you just generalize, then you're missing out specifics. And it is through the specifics that we tell each patient to what basically they are suffering from, and to be able to help them in that way. So type 1 diabetes. Type 1 basically is also what initially was referred to as juvenile diabetes mellitus, and it is because it was traditionally basically found in children and adolescents. This is basically when the beta cells in the pancreas, which produce the insulin, have been destroyed, and they cannot produce insulin. And this is a kind of autoimmune condition that basically end up destroying these cells. In patients with type 1 diabetes, one of the most discovered in medicine is basically discovering insulin, because before the invention of insulin, these patients who are type 1 diabetic, if they could come to the hospital, the doctors could not help them. They could just be in the ward, just dying in their beds. There was nothing else one could do for them. But with the invention of insulin, and then those patients started basically getting better. The use of because now they don't have endogenous insulin. It's only exogenous that they have to use to be able to metabolize basically. Get this glucose that is surging in the blood, going to the tissues, and be able to act that way. And then there is a type 1.5 diabetes. That's the second type. Type 1.5, yes, type 1.5. This is also known as LADA, that is latent autoimmune diabetes in adults. This is basically somewhat similar to type 1 diabetes. There is also an autoimmune that affects basically the beta cell of the pancreas not being able to produce the insulin. However, the difference, this is diagnosed, this is starting in adults over the age of 30. And the difference between type 1 and type 1.5 is that with the type 1.5 or LADA is that it's a slow progressing destruction of beta cells of the pancreas. This often takes about 5 to 10 years to get a complete destruction of the pancreatic cells, the beta cells. All right. And this is very pivotal to understand the differences, because if often this type 1.5 or later is misdiagnosed as a type 2 diabetes, which somehow not the same, and it's also may have implication how this type is going to be treated. Again, in Dr. Mura Health, the Diabetic Solution Program, we go into the details and the specifics into this program. So we mentioned type 1, type 1.5, and then we have what we call a pre-diabetic. Now, pre-diabetic, it's another way we may also classify it under diabetes, because this is basically a condition that precedes basically type 2 diabetic. So to diagnose this, basically you go to a hospital or a doctor, and then you ask it to be fasted. If your fasting blood sugar is between 5.7 and 6.9, more than 100 milligram per deciliter, then you are classified as pre-diabetic. Or we can also use what we call hemoglobin A1C, and that is if it is basically between 5.7% to 6.3%, then you are pre-diabetic. So pre-diabetic, basically, this often is associated with a weight gain. You may be having some liver and muscles become resistant to insulin, and basically it's a sign that diabetic is coming. And this is where most people are working on knowing basically that they may be actually having this pre-diabetic. So we have type 1, type 1.5, and then pre-diabetic. And then we have a type 2 diabetic. Now, type 2 diabetes, there is one with insulin, non-insulin dependent. This is basically when your fasting glucose is more than 7 millimole per liter or more than 126 milligram per deciliter, then you are classified as a type 2 diabetes. Or we can use what we call hemoglobin A1C, whereby if your hemoglobin A1C is more than 6.5%, then you are diagnosed as type 2 diabetes. Now, it's a type 2 diabetes non-insulin dependent, because you may still be producing enough of insulin. But because of the other derangement that we go into details in the program, the insulin still cannot function, or you're resistant to insulin action, but somehow you're still producing enough insulin. Again, this is very, very important. If it is not addressed, again, it can progress into different complications, of which we're going to go into details at a later stage. And then we have a type 2 diabetes, insulin-dependent type 2 diabetes. Now, this is basically your fasting glucose is more than 7 millimole per liter, or more than 126 milligram per deciliter. And what happened is, or your A1C more than 6.5%. So this is, you've been chronically using insulin. Insulin has been, when there is insulin resistance in the muscles, in the liver, and from many other reasons, what happened, the body, the pancreas, feels like you're not making enough insulin. So it's actually going to produce more. That's why in patients that are diabetic, especially in type 2, they actually may be producing more than enough insulin than what you and I who are normal are producing. So what happened is there is overproduction. With overproduction of insulin, and the pancreas, the beta cell in the pancreas does get tired. That's you may actually may be, that's why you find you are type 2 diabetic. But now they need to give you insulin to be able to control your blood glucose. Okay, so we mentioned type 1, we mentioned type 1.5, we mentioned pre-diabetic, we mentioned diabetes type 2, non-insulin dependent, type 2 insulin dependent, and there is gestation diabetes. Gestation diabetes basically, often it's basically the diabetes found in the pregnant women. That is, again, often it happens if you are given glucose tolerance test and you fail it. It is can be found in any stage of pregnancy, but it often is with the second half of pregnancy. It often just basically gets better after giving birth. However, although it disappears after birth, it is very, very important that you control this diabetes while you're still pregnant, because it may lead to complication like a premature birth. It may lead to preeclampsia. It's just some form of hypertension in pregnancy. It can also lead to a neonatal hypoglycemia after birth, and also if it is not really taken care of, treated, it can also predispose you to be type 2 diabetes in the following months or years. So it's very, very important that you also deal with this condition. And the last one, I think, yeah, when we type 1.5, we mentioned about type 2 non-insulin dependent, type 2 insulin dependent, and then we mentioned pre-diabetic, yeah? We mentioned pre-diabetic, and then we mentioned gestation diabetes. The last one is basically the secondary diabetic, what you call a secondary diabetes mellitus. And this is often basically caused by the drugs. It's more like a drugs-induced type 2 diabetes, or prescribed drugs to be specific. Now, there are a whole lot of drugs that can cause type 2 diabetes, but just to mention a few, for example, beta blockers that is often used in hypertensive patients. Propranolol to be exact. Now, what happened in beta 2? You give it to work on your beta receptors in the heart. But remember, the pancreas, the beta cell in pancreas also has the beta receptors. So by blocking the beta receptors in the heart, you're also going to block the beta receptors in the pancreas. In doing that chronically, you're going to decrease the amount of insulin that is being produced. If amounts of insulin are not being produced, then they're going to be chronically elevated sugar in your blood, leading to type 2 diabetes. Again, they can go other drugs like thiazide. And not only drugs, by the way, there are conditions as well, endocrine conditions that can lead you to type 2 diabetes, things like Cushing disease and so on. Anyway, I know I went very fast, but we do go into the specifics into the Dr. Mura Health Diabetic Solution Program. But I just mentioned this so that you know there is hope at every stage of this disease. All right. Of course, for example, in type 1 diabetes, of course, you need insulin to be able to control that. But what people often don't understand is that if you don't take care of yourself, it's not only insulin issue, you become resistant to the insulin. So you add insulin, but insulin is not making action because your muscle and liver, there is a problem out there. And what you find today, again, we're going to detail the program. Because again, from how it previously was diagnosed, how sweet the urine is, there is this misconception that the problem with the diabetes is sugar. The problem with the diabetes is glucose, that kind of thing. And when you go into details, you are going to actually realize, no, today the scientific evidence actually shows the major issue causing insulin resistance is not necessarily the issue of the carbohydrate. That is secondary problem. The major issue is intracellular lipid, having that fat into your muscles and the liver that end up leading to insulin being not effective. But we do go into details in the program. I hope this was helpful. If you have a question, please do ask. It is very, very important to understand what type of diabetes are you having, and sometimes many doctors may not necessarily be able to differentiate all different types of diabetes, but it's very, very important before you can really go to the root cause of the problem. Again, Dr. Mura Health Diabetes Solution address each specific of the conditions, and there is hope for each condition. Thank you so much for watching.